Hello, and a very warm welcome to all to today's ISNTD Connect. For those who are new to the series, this is our regular online meetup to learn about and discuss all things tropical diseases. And as you're likely to be aware, we unfortunately did have a break over the summer due to some unforeseen circumstances. Oh, hi, Yona.
Yona is here.
Thanks for joining us.
Hi.
Hi. And Thank you. I was just starting off with a very warm welcome to this session following our break. Delighted to say we are back, and what better time really to return to this very international, multidisciplinary and collaborative forum than on this World Rabies Day. So we're particularly pleased to kind of resume on World Rabies Day. Like many days, it is an important focal point, of course, to keep driving advocacy and awareness of disease, and in this case, rabies, but also, as is really close to our hearts here at ISNTD, this particular World Day is a real beacon to foster and accelerate those partnerships across regions and countries, but also across disciplines, and in the case of rabies, from the disease, the animal health, the environmental sectors, and thirdly, across sort of all strata of the global society, and a role for each and every one of us in there, from local communities all the way to official levels. And within this, a really particular role for the global youth, certainly an engine of change, of real change in those regions most affected by rabies. So on this World Rabies Day 2023, we're also some halfway towards the ambitious goal set in 2015 of reaching 0 dog-mediated human deaths from rabies by 2030, or 0 by 30. And that is quite the ambitious target for this disease that kills still nearly 60,000 people a year and is essentially fatal once symptoms appear. And so to take stock of the progress so far, but also to look at the steps ahead and to work towards and accelerate these efforts towards 0 by 30, I'm delighted to welcome our 3 speakers for today. And I'm sure you will join me too in welcoming very warmly. So firstly, on my screen, top right, it's our pleasure to welcome you, Dr. Frederic Lohr. Hi, Frederic.
Hi, everyone. Thanks a lot for having me.
Thank you so much for joining us. Frederic, you are Director of Strategic Partnerships at Mission Rabies, and we will hear a lot more about the incredible work and the huge campaigns that you have ongoing to tackle rabies worldwide. Thanks for being here. I'm also really delighted to welcome Given Sam. Hi, Given.
Hello.
Nice to have you here. Given you're a health environmentalist, you are a recent graduate from the Muhimbili University of Health and Allied Sciences in Dar es Salaam. Thank you so much for joining us today.
Thank you. Pleasure is mine.
We really look forward to getting a lot more insights from your in-field experience of rabies in northern Tanzania. So thank you for that.
Thank you.
And on my screen, at least bottom right, it's our pleasure to welcome Yona Yangaza. Hello, Yona. Yona, you are joining us today. You're representing the OneHealth Society, an NGO based in Tanzania as well. And you'll be talking to us a lot more about your work in mobilizing the youth across a number of diseases and NTDs through a OneHealth lens, and in particular, your work in rabies. So to the 3 of you, thank you so much for being here. Also, very big thank you to our audience. Very warm welcome to you all tuning in from around the world. We haven't had a chance to in brackets, see each other for a few weeks. Dr. Nebe, lovely to have you here. Professor Majid Fazihi Harandi, always a pleasure to welcome you. Semu Adeni as well. Comfort Olan Rewaju. Welcome, 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 everyone. And without any further delay, I'm going to hand over to you, Frederic, to give us a bit more of an overview of rabies, where we're at, and what are the really urgent next steps to reach this ambitious 0 by 30 goal. Thank you.
All right. Thank you very much for the introduction, Marianne. And yeah, as you said, it falls to me to kind of set the scene a little bit today. So let me just very quickly share my screen. Can you all see that?
Yes, super.
Awesome.
Thank you.
Great. So as Marianne said, I'm the Director of Strategic Partnerships for Mission Rabies. I'm a veterinarian by profession, so I come from the animal side into this, but nowadays really working more as a epidemiologist. And yeah, I'm overseeing our global program development here at Mission Rabies and day-to-day operations. So let's very briefly again talk about what rabies is. Some important stats that we all have to keep in mind and just always have to remind ourselves. In particular, this year on World Rabies, say how far away we already still are, despite the global goal. We have an estimated 59,000 human deaths from this disease every single year, and newer estimates actually, unfortunately, put this number even slightly higher at around about 70,000. It always depends. We have a sort of tip of the iceberg phenomenon with rabies that only very few cases are reported, but the majority of the cases is not reported. So we don't really know the true burden of rabies, but based on the data that is available, we still see such an unfortunately high number of human rabies deaths every single year. As it was already mentioned as well, rabies is a One Health disease, right? We have a disease here that works really, that works at the interface of human health, of animal health, and also the environment, depending on your setting in particular. So it's very great to hear that we have someone from the environment side in this webinar as well. So I'm really looking forward to the discussions here later on. 99%, the vast majority of all human rabies deaths are caused by dog bites. Obviously, any mammal is susceptible to the disease, but the majority of the human burden really comes from the transmission from dogs. The African and Asian continents are very disproportionately affected by the disease. We do have a few cases here and there in the Americas, but the vast majority of the Americas are now dog rabies free, or at least the human burden has been reduced to a level where it doesn't play that big of a role on the global scale anymore. But even in the Americas, we do still see human rabies deaths. But again, the majority in Africa and Asia. And a very unfortunate figure overall is really that the majority age bracket of the disease, of the victims from this disease, is really children under the age of 15. But all these terrible stats in mind, we know rabies is 100% preventable. It's a vaccine preventable disease, and attacking the disease really at its reservoir, at its source in the dogs, will help to save a sizable number of human lives every single year. So just a quick reminder again how it's transmitted. We are talking of a lizard virus of the Rhabdoviridae, and any mammal can be infected by the rabies virus. So the infection can occur through either a bite, that's the most common one, but also it can happen through a scratch or contact of saliva with an open wound or the mucous membranes. And I think that's always important, in particular when we're talking about puppies. You know, you play with a puppy, they are very, very bitey, very licky, and they lick you on the face. That is a potential route for exposure as well. Once the virus enters your body through mucous membrane or a wound or a bite, it then attaches itself to the nerves and centripetally walks up basically across the nerve, along the nerve, up into your central nervous system, where it causes encephalitis and then ultimately death. The incubation period from the virus obviously varies based on this route of infection. So the further away from the central nervous system the exposure was, the longer the incubation period. And that makes this a very deceptive disease as well, because sometimes there's not a direct temporal causality between being bitten and then developing the symptoms. If, for instance, the bite occurred on a foot, so there can be several weeks or months in between. We know the disease is vaccine preventable, but once symptoms develop, it is almost always fatal. So it's the most fatal disease known to humankind. As I mentioned, dogs are the main reservoir, in particular when we're talking about its significance for human health. But we also have other mammal reservoir species, in particular raccoons, mongoose, and of course bats. And bats play a significant role, in particular in the Americas. Globally, we see that over 150 countries are still endemic for rabies. And as I mentioned, the minority of the human cases occur in the Americas, and the majority really in Africa and Asia, with India being the most affected country, have an attributed third of all human rabies deaths. But the per person death rate is the highest in sub-Saharan Africa. But not just the human tragedy is significant with rabies, is also the economic impact that disease has on already struggling communities. So globally, an estimated $8.6 billion are basically burned because of this disease. The majority of that because of loss of productivity from premature death. As we said before, we have 40% of human rabies deaths occurring in children. So you can see there's a whole productive life that gets lost as well. So that is a huge part of this economic burden. Overall, dog interventions only play a very insignificant cost in this vast sum of $8.6 billion. So we really still have a lot of space here through increased investment in interventions in canines to bring that overall cost down. To remind everyone of what rabies looks like, basically we talk about two extreme forms, furious and paralytic rabies, but in reality, it is more a spectrum, and a rabies victim that shows symptoms can walk through that spectrum to various degrees at various speeds. When we're talking furious rabies, that's really the rabies as we all imagine it from movies, from stories. It's the restless dog, agitated, aggressive. And what we're seeing is the buildup of excess saliva due to the throat paralysis. And we also see this hyperactivity. Whereas the paralytic rabies is really more like the diametral opposite. The animal retreats itself, is ataxic, so it's a bit wobbly on its feet, and it shows increased muscle weakness. So rabies is really specifically unspecific when it comes to describing what the symptoms look like. So you always have to see it in a holistic way with a history of potential exposure, these neurological symptoms, all of that together gives you a picture of whether the animal might be rabid or not. What we do see, once symptoms set on, we usually see death within 10 days. And that is in particular very important when it comes to quarantining animals after, for instance, a bite exposure. If the animal is still alive 10 days after the bite, it very likely wasn't rabid at the time of the bite. It doesn't say it can't be rabid further down the line, but at the time of the bite, and that is what we're really interested in, it wasn't rabid. So just to give you a little bit of a brief background on us as well as an organization, Mission Rabies is a global non-for-profit, an NGO, and we're working on efficient, systematic, economic, transparent, and scalable approaches to canine mass vaccination, rabies education, and rabies surveillance. So we are very boots on the ground, working with local and national stakeholders to develop programs that put that theory into practice. We want to document all the successes and the failures, quite frankly, as well, that happen in rabies control and elimination, and then help stakeholders and governments to scale up these efforts. Currently, we have two major project sites, one in Malawi, in the southern city of Blantyre. That's where we are based. That's also where our Africa office is. In Malawi, we vaccinate every year around about 100,000 dogs in several districts in the south of the country. And Malawi the hospital in Blantyre reported the highest number of pediatric rabies deaths of any institution in Africa back in 2012. And that's really why we started working there. And by now, we've brought it down to pretty much 0 pediatric rabies deaths in our project area, or any rabies death really occurring in our project area down in Malawi. The other big project that we run, and that's where our India office is as well, is in Goa, the state of Goa, where we started working in 2014 and really have now achieved to have Goa declared a rabies controlled state. And that's really a huge achievement. No other state in India has ever achieved that before. So we've brought down human rabies to 0, and we brought down dog rabies to almost 0. We just see it in the border region to the neighboring states in the north and the south, a little bit an incursion every now and then. But basically, we have controlled rabies in Goa state, and this model this Goa model is really a success story for the entire subcontinent, and is now slowly being taken on by neighboring states and other cities as well, in order to replicate that success and get to the same stage around it. In addition to that, we also run smaller projects in Uganda, Tanzania, Mozambique, and Ghana, and Zambia in Africa, where we work again with local stakeholders and the government in proof of concept or pilot programs, where we test out new methods. And we also, as I mentioned, publish about them in order to transfer that knowledge to other stakeholders. And in Asia, we work in Sri Lanka, Thailand, and Cambodia, with Cambodia really standing out as well as the next big of our bases. Really, earlier this year, we've managed to vaccinate the entire capital city of Phnom Penh in 10 days, 75,000 dogs vaccinated, basically. So we want to take that model really as a blueprint for Southeast Asia as well, and continue our efforts in Cambodia together with the Cambodian government. As I mentioned, we publish on a regular basis. This list is not entirely up to date. We recently, last year, had a big publication as well in Nature Communications about the success in Goa. And as you can see, we're very active trying to disseminate the knowledge that we gain in the field. So that being said, with all of this background, in rabies, we do face quite a lot of challenges. I mentioned initially the underfunding currently on a global scale. In all honesty, that is a huge problem, to have sufficient funding, make funding available to governments as well in order to start implementing these programs. But also from a logistical scale, there are quite some challenges, and I wanted to just discuss some of those with examples from our program. So, as I mentioned earlier, mass vaccination is really the most effective method of eliminating rabies at its source. And what we want to achieve is really getting that 70% vaccination coverage in the local dog population in a homogeneous way. Through this herd immunity, we can then really break the cycle of transmission. Rabies has a very, very low R0 of just over 1. So it doesn't need that much in order to break that cycle. But as you can imagine, in an environment where we don't necessarily know the size of a dog population, dogs have different types of ownerships, and I'm going to touch on that in a second, and also different community attitudes towards dogs and dog handling make this an extremely challenging task over time in order to achieve that 70% vaccination coverage. So looking at different vaccination methods, and I'm just going to discuss some extremes. Similar to the symptoms of rabies, vaccination methods are also a bit of a spectrum depending on what local dog ownership is, what the local dog population looks like. But in general, we do have the central point vaccination, where we set up camp at a specific point, people bring their dogs, we vaccinate them, they take their dogs again, very easy. We have door-to-door, where we literally have teams going from house to house, check out their dogs, and if their dogs, vaccinate them there. Where we have a lot of free roaming dogs, catch, vaccinate, release, teams with these big butterfly nets, catch the dogs in the street, vaccinate them on the spot, and release them again. So let's look at these methods on the example of Malawi and Goa, because there we have two very different populations. So have a look at Malawi first. And in Malawi, when we're looking at the dog population, we see that the vast majority of these animals are actually owned, and only a very, very small part of the population is actually completely free roaming or stray. But when we look at the confinement status of these dogs, we see a slightly tilted picture there, with the vast majority of the dogs actually being free roaming. So the owners, even though they have an identifiable owner, the owner let them go at a time of the day. The dogs roam around. That's really how the virus persists in the population. But again, these dogs are owned. So as you can see on this picture here, they often do have someone in a family that tends to them. So in these situations, we really want to use central points in a very efficient way. And we want to really make sure that these central points are strategically placed in order to reach all the communities at the high enough density to achieve our vaccination coverage. So as you can see in these pictures here, you have people queuing outside. This is a school in Malawi, for instance. And then the owner holds the dog. We can vaccinate the dog and get through quite a lot of animals in a very economic way. We've done some analysis. This, for instance, is an analysis in Malawi that we've done. And as you can see here, we've plotted how far people actually walk to static points. And from that on, we could actually identify how dense we have to place these static points in order to achieve, at what distance to each other we have to place these static points in order to achieve 70% vaccination coverage. But if we're on the opposite, looking at the dog population in Goa, this is a slightly different picture. As you can see here, it's roughly 50-50 stray and owned. And the vast majority of all of these dogs are actually roaming. So for these owned dogs, similar to what we see in Malawi, we can actually employ the door-to-door method. So here we have a slightly smaller team, just 2 people on a motorbike, and they can go through the streets. They can attract these dogs that are used to handling. They have usually a pack of treat. We call that hand catching. They usually have a pack of treat. They attract these dogs, vaccinate them on the spot. The dog is happy, they got a treat. We are happy because the dog is protected, and therefore the community is protected. And equally, when there are dog owners with dogs in their houses, we can, of course, vaccinate these dogs as well. But what do we do? What do we have to do with this large proportion of roaming dogs that might not necessarily even be able to capture it by hand? We need these catching teams and do catch, vaccinate, release. And as you can see already on this graphic, this is very involved. You need a lot of team members. It's very expensive. You need a lot of training to have really good, skilled dog catchers to work in an efficient way. So it works, but it's very economically intensive. So in these situations as well, there is a new method that is coming up. The vaccine is now available. It's not licensed yet for full canine use everywhere. So there are some challenges in that regard, but it's coming more and more to the foreground, and that's the oral bait handout. We now have an oral bait that we can specifically target these dogs with that we otherwise couldn't hand catch or catch with the catching nets. Like for instance, in this situation here, you see 2 of our catches here on this huge rubbish dump. And in those situations, it's almost impossible to get these dogs. But by throwing them a tasty treat and them chewing it and releasing the vaccines into the oral cavity, we can then at least try to vaccinate these dogs in an efficient way. So when we're looking at vaccination coverage overall, which is another challenge to achieve, but we're just looking at it from an epidemiological point of view, we would only need to achieve 40% vaccination coverage, so 40% of all the dogs in an area to be vaccinated. But what we are dealing with are highly dynamic populations, right? So we have a vaccination campaign here. The dogs are being vaccinated. We achieve our 45%, 50% here in this graphic, but over time, this proportion falls due to death of animals, to born puppies. So we're diluting our population. And then we achieve that again the year after, but it rapidly drops again. So as you can see here, for the majority of the time, our population curve is below that critical threshold. So we still have, in these situations, we still have potential for the virus to circulate and maintain its presence in the population. So this is why we're really aiming for the 70% coverage. So as you can see now, over time, if we achieve our 70% coverage, even with the dilution of the population, we still maintain our population coverage above that 40% that we want. And that line is flexible, depending, the 70% line is flexible depending on the population. It is a published parameter, but it obviously always depends on our local dog population and what the population turnover is in order, what sort of coverage we need to achieve. Because what we see here again, and I always find it a bit easier to visualize as well when we're looking at it from a map point of view. As you can see here with this map of Goa, what you see in orange is 70% coverage of the state, but we have created these sort of areas here where the virus can still circulate. So it's very important as well to have proper vaccination team management in the field as well to prevent this virus from, to prevent areas where we have these spots where the virus can still circulate and then ultimately break out. So we really want to achieve in difficult areas like this sort of homologous coverage that enables the virus to the vaccination coverage to be at 70% throughout the entire area, not just in segmented ways. So you can use mobile applications with our own mobile system. There are other mobile systems out there as well that collect the information and visualize this in a great way. And this is very, very helpful when we're going through a campaign like this. For instance, you see this specific area in Goa. You can really follow how the vaccination teams have been working over time, working their way throughout the state and covering it in a very dense and efficient way. So another challenge that we're facing, other than these logistics, is just the overall coordination and really persistence with our intervention as well. So this is a random timeline at the bottom, but it represents a relative reality. So if we're looking at our different stages that we want to achieve, from rabies being present in a country over the control stage, we're eliminating it first in the human population, then in the animal population, and later on dog population, and later on maintain this freedom from the disease. We're facing different challenges along the way, and it's very easy to sometimes drop the ball at any one of these stages and basically catapult us back to a previous stage there. So what we see in an endemic phase is that we have a huge number of dog rabies cases. We do have a sort of like oscillating bottom line of human cases. And where we really want to start is really improve our surveillance and our awareness. Apologies for the spelling mistake there. We really want to increase our surveillance so that we actually get all of these cases, that we can paint a true picture. That is often, as I mentioned initially, through this cycle of neglect, because we don't really know the true burden of rabies. It's often brushed aside and therefore not fully recognized as a disease that requires resources, that requires intensive interventions. And at the same time, of course, we want to raise awareness within the communities in order to report dog or animal and human cases as well. Moving forward into the control stage, and that takes a while to get there, we really want to start our mass dog vaccination following that. And as you can see, our cases dramatically decline relatively rapidly once we start our intervention in the form of mass dog vaccination. And this mousestock vaccination will have to go on for a while. So this is not just a 1 or 2 year intervention. And at the tail end of it, once we reach our elimination stages, we also need to start thinking about border control. We need to think about how we want to proceed with wildlife, because as you can see at the tail end of this, we still see the odd flare up here and there. And we really have to be aware that mousestock vaccination is not a sort of finite activity. It's really timed and depending on how we are proceeding with our wildlife, how we are proceeding as a region, not just as a country, in our progress towards rabies elimination, because we will always have these incursions here, for instance, whether that is from a neighboring country or from a wild strain. And in those cases, we do really have to keep vaccinating our animals, restarting that. And at the same time, again, we should not forget to continue our surveillance and awareness at the same time as well. That will always have to go on. And I think that is where a lot of misunderstandings happen as well as we're going through this. The good thing is, together we can really do this, together we can achieve it. And I'm really looking forward to discussions in this panel now on how we can achieve this and move forward in our respective areas. So thank you very much, and thank you very much to all of our partners in particular who make this work possible. And yeah, I'm really looking forward to the discussions now. Thank you.
What can I say? Thank you so much, Frederic. That overview was really, really useful, extremely comprehensive, but also really realistic. Not just celebrating some of those amazing achievements, namely in Goa and in lots of other areas, but also sort of giving us a really clear view of what it looks like moving forward. So thank you so much for that. And if there's one thing that Mission Rabies is really good at, is being very active in your partnerships, the way you disseminate knowledge. In fact, I think our own partnership goes back many years ago, if I'm not mistaken, because COVID, the lockdown sort of added years where you didn't think they were. But back in 2017, I think we actually we gave Mission Rabies a well-deserved award for this rabies app. I'm sure it's evolved over time, but at the time we were really stunned by the impact that such an app would have in tracking all these vaccinations that can be really difficult to keep a handle on. And in fact, there are already some questions about that coming up in the audience. So we will come back to that in a bit. But for now, thank you very, very much. We're going to shift a little bit now to the perspective from Tanzania with some words and insights from both Given and from Yona. And so without any further delay, I'll hand over to you, Given. Thank you for joining us. I'll pop your slides up. There we go. Yep, we've got them. Over to you. Thank you.
Thank you so much. Thank you so much, Marianne. And so we are going to proceed with the mission to ending rabies by 2030, and we are going to oversee challenges and opportunities in this whole disease and the whole the whole role of ending rabies. So first of all, I just listed the basic rabies basics. And first, it's a viral disease affecting the nervous system caused by Lissa virus. And this is what makes it hard to cure someone when they have already manifested the clinical signs, because it is neurotrophic. So most of the time when the rabies virus affects the brain, it's really hard for the immune system to intervene. And that's why most of the times it's really hard to cure someone after they get the disease. And so in the global aspect, more than 59,000 people die of rabies worldwide every year. And 99%, unfortunately, it's in the African and Asian countries where dog rabies are endemic. But we have hope, and this is because in the past 30 years, the disease burden has declined, and that's the hope that we have in the next, I mean, by the time we reach 2030, we'll have either 0 death, or there will be a maximum reduction of death by the disease rabies. And so I highlighted what's happening in Tanzania. And first, by the way, in Tanzania, we have almost 1,500 people die each year from rabies. You can imagine. And most of the areas that are highly at risk, it's the pastoral communities, or areas where they're near the forest or wildlife reserves, because of the interaction between human and the environment, but also due to the presence of wildlife. And most of the animals that transmit the disease are mostly in the forest reserves. So, and this, having saying that, it's among the areas where rabies is really prevalent, and most of the cases you find them in those areas. And such areas are mostly in the northern part of Tanzania, as which was my field study that I'm just from doing like 2 weeks ago. And so I'll be sharing very short insights from my field experience in the northern part of Tanzania, if a region called Geita, which I've recently done a research just to collect some data on what is happening in that area. So it's a northern part of Tanzania, and it's in the lake zone, where most of the people engage themselves in the activities of livestock keeping and agriculture. And some of the challenges that we notice when it comes to dealing with rabies, first of all, large number of people are not aware of the disease. Okay, they could be knowing it, but they do not know exactly how it's caused. They know that if I'm bitten by a dog, I should get vaccination, but they don't know the details of it. So there is a gap in that aspect. They just know what they should do because of the costs or because of the fatal effect of rabies, but not because they're knowledgeable of the disease. But again, there are a lot of misconceptions. And when I talk of misconceptions, it's, I think, in Africa and Tanzania being part of it, most of the people relate to these diseases with superstitious beliefs. And that's something that has been challenging even when we were collecting data, because most of the time, all the people that you encounter that they have died of rabies, they had the potential to get services, but they couldn't go to get services, but they opted to go to superstitious doctors, or those they could relate them to witchcraft and all of that. So it was really hard to intervene, because there is a gap. They know that I've gotten bitten by rabies, but they can't seek help, and they would rather go for traditional medicines. But again, the health centers where people could get medications are very remote. It could be very far from where those people are located, because now we were more focused on the rural areas, though we took some data from the urban areas, but most of the rural areas are located so far from the health centers. It could even take more than 15 kilometers or 20 kilometers to the area, and you can imagine transport is really an issue in those places. So you'd find people would rather use the money to get meal for the day rather than sending their relative or their fellow community member to the hospital, because they're very far and really remote. So, but one of the good things that really helped, there is a good number of people who vaccinated their dogs, but despite the gap that existed, so one of the successful initiative in the areas that really helped with people to vaccinate their dogs was responsible pet ownership. And when I talk of responsible pet ownership, I am considering the fact that most people had fear that if my dog bites my neighbor's dog, I will have to cover the cost for their treatment. So most people would take care of their dogs just because they are scared of being responsible for the treatment of the other person once their dog bites the other person. So I think that was something that was very innovative, I think, because most people could take care of their dogs, or could make sure their dogs are bitten just to get the card to verify that my dog is bitten, so that if that dog bites the other person, they'll be safe not to cover the costs of the victim. So that was something which that enabled most people to vaccinate their dogs, and I could say it was a success. Next, I would talk about the journey to 0 by 30, because now I'm relating the field experience and what we have ahead of us. The field experience relating to the goal of 0 by 30, because now the global strategy is to end human death from dog-mediated rabies by 2030. And the target is to reduce incidences of rabies, and also to make sure that our community is well aware and we have vaccinated animals or dogs. But we have a gap here. And I mean, regardless of the progress, I stated earlier that we have hope for the burden has reduced for the past 30 years. But despite of this hope, as I mentioned, the field experience, we have a gap, and we have things that we need to cover to make sure that this disease is going to truly be eliminated by 2030. So what are these gaps? So most of the Tanzanian rural communities are unaware of rabies and its causes. As I mentioned earlier, most people would wonder, and one of the funny things is that some people would relate rabies to epilepsy. They'll think that rabies is epilepsy. So there was a gap, and some people would even wonder, dogs could cause rabies. So it was something of the sort. So I could say there is an education gap or information gap or awareness gap in these communities. And regardless if it's rural or even in urban areas, there are still people who can not really link what is really happening in the whole aspect when they hear about the disease rabies. So one other thing, and we are very aware that rabies is an integral of the One Health approach. And because One Health, we integrate the human health, the animal's health, and the environment part. But despite the efforts to integrate the One Health approach into the system so that there could be coordination of all the disciplines in approaching these diseases, particularly rabies, there is still a gap, because most of the disciplines in those areas, or the systems that are dealing with diseases at that area, there is very low rate of collaboration. Each discipline works on its own. And one of the things that made us know that there is no that collaboration is the fact that some of the animals were killed. Some of the dogs were killed because there were a lot of stray dogs, and what the the veterinary doctors would do, they would rather kill the animals rather than vaccinating them. So there could be conflicts between the veterinaries and the people from the animal welfare, because we have to vaccinate these dogs rather than killing them. So that's one of the gaps that exists. There is no collaboration or coordination between those disciplines. But again, dog vaccines are not efficient and very scarce. And this was proven by some of the people that we got to interview. They were speaking of not being sure of the effectiveness of the rabies. Because there are incidences where a particular person vaccinated their dogs, and it happened that 2 months after vaccinating the dogs, they got bitten by a wild animal, a fox. But these dogs died of rabies. So this brought question into the community, like, are these vaccines really safe? Are these vaccines effective? So most of the time people will tell you, like, if you ask them, do you think if you vaccinate your dog, you reduce the prevalence of rabies? And people will be like, yeah, I think if the vaccine has quality, you see. So most people could not believe that vaccines were effective, or they were really going to tackle the disease. So, and now if we are going to make sure vaccines are there and people are vaccinating their dogs, of course we're going to reduce the dog killings, or the way people approach the whole aspect of stray dogs by dog killings. So next is what I'm going to give the way forward, and I particularly wanted to talk about the role of youth, because I find youth as agents of change, and we are very active, and we can go beyond what is seen. Youth can organize a lot of awareness programs and reach to the peripheral areas or rural areas that are so hard to be reached by other people, but with appropriate support and mentorship. So I would say conducting more community outreach programs, especially at the rural areas, to eliminate, oh my goodness, that was a mistake, but to eliminate rabies in the communities. So I am thinking that due to the knowledge gap that exists in the community, there is a need for a lot of outreach programs in rural areas, more specific, because they need knowledge, and at times knowledge can beat resources, because if somebody is knowledgeable that this is how rabies is being acquired and this is what happens if I don't get treatment, people are going to take action. People are not going to see the distance as a barrier, regardless the fact that most of the health centers are very far, but they're going to take action to make sure there is no death due to rabies. But again, mass vaccination programs, and I have had good luck to participate some of the mass vaccination programs by the Afro-Hun. So we conducted one by 2021, and we vaccinated almost 1,000 dogs at a part. So it was really amazing, because we are seeing that with these efforts of mass vaccination and coordination, in the One Health coordination, we are going to ensure that dogs are vaccinated rather than just being killed. And when dogs are vaccinated, we are sure of protecting the human health, and the goal of 0 by 2030 is definitely going to be achieved. And last but not least is what I talked about, beyond the bite, and this is due to the effects of rabies beyond what we can see, beyond that patient. The family members that are dealing with the patient are also going through psychological impacts, but also the community at large. And at this point, I could support PTSD, post-traumatic stress disorder, and most of the people had so much fear of no longer wanting to keep dogs. And the fear was beyond that, because most people, not just they didn't want to keep dogs, but they would not want to, they would be so what do I call, like very vigorous when they get bitten by another dog or a neighbor's dog, and it will even cause conflicts, because people were so worried of their health and their life because of what happened to their neighbor or what happened to their relative. So a lot of people were experiencing a lot of trauma related to losing their neighbors or losing their family member due to rabies. And so I saw that there is a need for psychological and mental support to these families or communities affected by rabies, and that's something that we need to see over, and that is just due to my passion for mental health as an advocate, and I thought it was something that really need to be addressed. So other than that, I would like to thank you so much for your attention, and I'm looking forward to the questions and the discussions later. Thank you so much.
Thank you very, very much, given, what can I say? You've given us so much food for thought, so much experience in your quite budding career in infectious diseases as a health environmentalist. Really, you are the One Health approach embodied into one. Amazing work that you did as part of the NGO, the African One Health University Network. You've also worked as an intern with the Ministry of Health in a very multidisciplinary approach. So it's been so enriching, listening to everything you've shared with us today. I liked your phrase, knowledge can beat resources. Absolutely. And also giving us really that food for thought about beyond the bite. And like many diseases, as we approach the goals, the kind of last challenges, the last hurdles really are going to depend on that granular understanding of communities, how people think about their dogs, what they're worried about, and also on a psychosocial level, what really is important to communities. So thank you very, very much. And that provides a really good transition to our last speaker, Yona. Yona, you are coming today as a representative of the OneHealth Society, where you work tirelessly, I think it's safe to say, to share knowledge, drive advocacy for NTDs, also AMR in a different field, and youth, of course, being the real engine behind all this. And that is of particular relevance when speaking about rabies, because estimates kind of place that somewhere between 30 and 60% of those awful fatalities annually as being in really reaching out to the youth on the one hand, and also harnessing the youth is a very important part of getting to these 2030 rabies goals. So without any further delay, Yona, we'll hand over to you. We want to hear all about the OneHealth Society and all the advice that the youth has to give to us in terms of reaching those landmark goals. I wonder, Yona, I'm so sorry to interrupt you. I wonder if you're not on mute at the moment.
Hello.
Perfect.
Thank you so much, Marianne, for the thank you so much for the chance of representing the youth perspectives and fighting against rabies. And without forgetting our audience, I really appreciate it for their presence. Yes, my fellow has been already given the brief about the rabies and what we're supposed to do for the making sure that by 2030 we are in the end of eradicating the rabies. So I'm here to give the youth perspectives from OneHealth Societies. But what are we speaking what we say about OneHealth Societies? This is the youth-led NGOs registered in Tanzania and active 24 since 2019 for fighting against antimicrobial resistance and the negligible tropical disease. So it has been made with various missions. Next slide, please. Yes, this as we have been said that the youth network in a global health is with various missions. Our first target is the youth-led is fighting against antimicrobial resistance and neglectable tropical disease. As we know that the NTDs itself is caused a burden to 40% of African communities. So by looking at gaps, we say that we have enough human resources from Africa's the youth who are very active in changing many things. So we believe that through using this youth who are present in Africa, as according to that 70% of the youth who are from Africa's is total the population of the youth population of Africans who are present in Africa by 2030 will be youth. So the mission is to conduct impactful training, advocacy, community engagement, and research to influence social behavioral change in fighting the global challenges, that is antimicrobial resistance and negligible tropical disease. But what the vision of OneHealth Societies is to achieve a healthier communities in which a global health challenges that antimicrobial resistance and negligible tropical disease is already mitigated and contained. So I'll speak a little bit about the youth. Why do we think that the youth are the vulnerable group for making this mission to be possible? Yeah, by looking at the statistics from UNDP, they said that the population of the Africans, sub-Saharan Africans, they are youth. So by identifying that vulnerable human resources, we think that through consuming this youth from the health professionals, human, animals, and environment can help us to eradicate this rabies by 2030. So what are the youth supposed to do when we are speaking about youth in eradication of rabies? The first point I can speak about is advocacy and awareness. We saw the meeting of Geneva in June 2023 that one of the priorities of the WHO was about the advocacy and awareness. We believe that the youth can play a vital role in spreading awareness about the importance of vaccination, responsible pet ownership, and prevention of rabies. They can use the social media platform and organize campaigns to participate in the community event to educate people about the risk of rabies and how to prevent it. Also, we know that through using that human resources they have at the youth, it's easier to engage in volunteerism. Youth can volunteer in animal shelters and veterinary clinics and other organizations that work towards controlling rabies. They assist in vaccination drives, help in animal care, and provide support for the staffs. Next slide, please. Also, through the policy advocacy, we believe that youth can advocate for the policy that is support the eradication of rabies. They can engage with the policy makers, participate in advocacy campaign, and raise awareness about the importance of the government support for rabies control programs. Yes, as they have been discussed for the WHO and today's partner meeting, that we are to shift from the donors fund to the government or country ownership. So we believe that through capacitating those youth who are present in the countries, it's easier for them to complete the mission of the country ownership. So if we could not use those youth who are present, it could be difficult for us to find the solution on eradication of rabies. Also, so there are various challenges that has been facing the youth why they don't engaging in this. One of the challenges that facing the youth from Africa and other countries is lack of awareness and education. So lacking of awareness and education about rabies is something in the community that can make a big challenge for the youth to engage people about the risk of rabies and how to prevent it. So sometimes we meet with the difficultness from the cultural beliefs. For example, in Tanzania, we have almost 120 tribes. Every tribe has its own belief. So it's sometimes become difficult for the peoples from various tribes to have the common understanding on fighting against rabies. So there are many cultural societies that prevent the youth from taking an active role in controlling rabies. For example, in some culture, it might be considered inappropriate for young people to engage in activities related to animal or public health. Yeah, out of the cultural beliefs from various societies, also there is another challenges that have been affecting youth to participate in eradication of rabies by 2030. Lack of coordination and collaboration. Lack of coordination and collaboration among different organizations work towards controlling rabies. This can be made difficult for the youth to find opportunity to contribute and to make a meaningful impact in the societies. So do you know we have a lot of number of youth who have been completing their graduate studies, but due to the difficulty of to get the mentorship from various platforms that supporting the youth to engage in fighting rabies, sometimes it becomes difficult for them to have the knowledge, or exactly knowledge and the skills to engage in fighting. We believe that advocacy is something that can make changes within a short time or period if we use it safely. So by giving that overview, that is how can I contribute on a youth perspective on eradication of rabies by 2030. And we still believe, we know that the rabies is a zoonotic, and the zoonotic diseases that is being transmitted from animal and to human. So 100% is prevailed by vaccination of dogs. So all of things we are doing that we do not supposed to go away from advocacy of vaccination of dogs. So if we are going to use the youths who are present from various communities, it's easier for this to reach the target of 20% of eradication of rabies. So I'm returning the mic to the moderators and waiting for the more discussion.
Thank you, Yona. And one thing that's for certain is that you have a huge amount of energy. You are super connected, always on social media. And it's been really interesting to see actually some of the barriers that you mentioned in terms of getting the youth involved. There is a huge appetite that's evident across all these diseases of poverty, across issues around inequality and health, and lots of other things, as we've seen, for example, with the SADC youth movement. And it seems to me like you might be the natural port of call to organize a little bit all this huge amount of energy that's coming through, allocating it to the right sectors, the right projects, giving a little bit of direction. And so thank you so much for your insights into this. And in some way, you're basically your leadership. So thanks for that. And I know this is, of course, that's very close to your heart, if you don't mind sharing, because one of your very own friends lost his life at a very young age to rabies. So I am sure that you're very keen to make a difference. So thank you for sharing all this with us. And as you said, it's time for some further discussion. So if I could invite both Frederic and Given to join us, and perhaps just to open up a little bit the discussions. Actually, before I do that, I don't know if you've seen speakers in the chat, but you've had a lot of really great compliments, and I definitely echo and amplify those. Semga Deniu was saying beautiful presentations. Chandrakant, Ravanka, all three presentations are really good. Congrats to the speakers, and many, many more sort of lots of compliments and lots of thanks coming in on the chat. So I couldn't agree more. Thank you so much. And one of the things we heard at the start was about how rabies has still a very heavy burden in terms of mortality, and also it's really terrifying situation whereby when symptoms are visible, death is pretty much certain, except I think for about 15 people worldwide who've ever recovered from rabies. And so, and Frederic, even you told us the statistics could be actually even more heavy than what we've been used to hearing. So with all of this, and turning to 2030, my first question to the panel perhaps would be, what do you see as a real positive beacon out of all the work or all the programs, the research and what you've seen in field? What do you think we can really hold on to as a very positive, forward-looking issue or next step or program that we can leverage? And perhaps I'll just go in order of the speakers. Frederic, sorry, you first.
I was afraid of that.
Yeah.
Oh no, don't
I
ask
feel
me.
like an awful school teacher now, picking on.
All good, all good. No, and thank you very much, Sam and Yona for your excellent presentations. That was really, really good to see. And I think actually that is, I think probably the most positive is actually seeing that sort of change in the last few years. More and more groups getting involved, getting youth involved as well, and really leveraging this grassroots movement in rabies elimination. And let's be frank, in some areas we're talking rabies control. We're currently not talking rabies elimination, right? As it's been highlighted by some of the speakers, we are still in some areas miles behind. And will we achieve that at 2030? Time will tell. I hope we will, but we are still behind. But seeing that enthusiasm from the next generation and really leveraging that, I think that is really one of the very positive stories here. And we see that across the board. In Malawi, we're using community-based organizations to sensitize the community ahead of mass vaccination campaigns. So that enthusiasm is really there, even in rural communities, or I should say probably particularly in rural communities that are heavily impacted by the disease. So I think that is probably one of the biggest positive takeaways here. And let's build on that, really.
Fantastic. That is something to hold on to. Given, I'll hand over to you for the same question.
Okay, so on my perspective, I could support something positive that we can hold on to is that people are willing to learn, and I think we can invest more in education, because the more people are aware, the more sensitive will find the burden. So the more people have enough knowledge, as I said earlier, and I feel like people are going to take the issue more serious. They're going to vaccinate their animals, because I could see that in the field, most people do not have, most of the rural areas, people don't have affiliation or affection to their animals. It's just the animal is there to protect their livestock. So, but if these people are given awareness or education, they're going to see the value of keeping their dogs in a more safety and secure way. So I think we can hope on education, and it's something we can invest more on, followed by vaccination. Thank you.
And how about you, Yona? What stands out as a real positive for you in terms of rabies, tackling rabies?
I think Yona is facing some internet issues.
Oh, yeah. Can you hear us, Yona? Oh, hang on. Oh, your microphone's back off. Yes, got it.
Yes.
Sorry.
There you go.
I always give it a second or two for the connect. Oh,
one issue that I'm believing that. Hello? Do you hear me?
yeah, and we can see you as well.
Do you hear me?
We can hear you, Yona. All good now.
No. Okay, thank you so much. So I think that one of the issues I can speak here that what you can do for the eradication of rabies for the different communities, that first of all, we have to incapacitate these youth who are present. You know, we are in lack of human resources who are capacitating first of the youth who are present. It can be easy for us to reach this target of eradication of rabies by 2030. We have to focus on the youth who are present in that communities to be aware on the impact of rabies. Do you know the 40% of the fatality of the death of rabies is if this community are well incapacitated with the knowledge on the impact of rabies, and I hope to prevent that eradication.
Fantastic. Do you feel that, and this time Frederic will go in inverse order, do you feel, Yona, in the time that you've been working in rabies, and same question to Given and Frederic, that in terms of awareness of the disease, has there really been much of a change? Rabies is one of the lucky neglected tropical diseases that people can actually pronounce and have possibly even heard of before. It's pretty much out there in the kind of global knowledge. Same with leprosy. I mean, these are actually diseases that people know of. But can that sometimes work against advocacy? Do you feel people still realize that it's such a burden, that it is so hard to treat? What's your perspective on the shifting awareness of rabies? Yona, you can go first this time, if that's okay with you.
Okay, how the community can fail on the sense on fighting against the rabies. The advocacy itself does not enough, but there are some strategies that must be followed. But one of before the strategy has been foreign to the communities, we have to start with the advocate, the people to sensitize, to be aware on what is going to be done. So I think advocacy itself does not enough. Since after giving the education, then they go away, no feedback on monitoring on what they have been provided to the communities. So I think if we incapacitate the native communities, it's easy for them to feel a sense of the ownership. The community itself, they can engage in fighting. They can feel the sense of the project that they are among who are supposed to be, who are going to be affected if they will not follow this instruction from different professionals on a One Health approach.
Okay, that's a really interesting point, actually, that regardless of the awareness or the education of communities about rabies, to have an easy way for action is really important, and that should go hand in hand. So Given, I'll ask you that similar question. How do you feel awareness, understanding of rabies is evolving at the moment? What have you seen?
Hello?
Yeah, we've got you.
All right. So you are saying, how do I think if awareness really helps merge the gap? Is that so?
Yeah, and also if is awareness improving, or what have you seen in the communities? How fast is it improving?
Okay.
Is this still something we really need to work on?
Of course. I would say, okay, since first, as rabies is you said earlier, it's a neglected tropical disease, and it's the lucky neglected tropical disease, of course. But from my experience, because with the rabies movement, I started being active in rabies since 2021, and that's the first time I went to the field. As earlier I told you, I talked of the project with Kisarawe, where we did with the same organization, Afrohun, and I think among most of the organizations that is doing the real work in the field, AFRON is trying its best, and by going to the community and giving people the necessary education and providing vaccines for the community. But I think there is still more efforts are needed, because not all communities are being reached with the education on rabies. And as I said earlier, with this recent project that I've done, most people are still not well equipped on rabies. They do not know, they know little bits of it. They just know, if I get rabies, I'm going to bark like a dog, but they don't know like the real disease. Like, okay, what am I supposed to do? They just know that I should just wash the wound or go to our traditional doctor and all that, but they do not know that I should take this serious, I should visit a doctor, I should get medication, or I should get vaccination for it. So I think there is still a need, though there is, since my exposure, I'm saying from 2021, I'm seeing there is, I think because now I'm already in this field and it's something that I'm doing, so I find there is effort, but this effort, there is still a gap that needs to be worked on, because not all communities are reached with appropriate education, and particularly as those communities that are highly at risk. Yes.
Brilliant. Thank you. Frederic, what have you seen?
So first of all, I would like to disagree with you, Marianne, controversially. I don't think rabies is the lucky NTD. I would go the diametral opposite, and I would say rabies is actually the neglected NTD, if I want to double the neglect up here. Rabies doesn't show.
I phrased that very poorly, agree.
I remember looking at the wider NTD sphere. Let's not kid ourselves. Rabies is not really featured there, and I don't really. I mean, I've been in rabies for 10 years now. I don't really understand why that is, and that's why I actually like being here in this webinar with you guys to engage with the wider NTD sphere as well. Because I think that's probably where we as a rabies community have been lacking a little bit. To actually advocate for ourselves a little bit more within this very, very limited world of NTD investment as well. So I think that is one thing, just because I'm a stickler with that. I don't like when people call rabies is a lucky disease. It's really not.
Lucky could be positive, right?
I don't know. You tell me. What is positive about that?
I mean,
I'm happy. I'm happy to learn. I'm happy. I love this. Please.
Do you think part of it might be? Oh, sorry, Given. There's a bit of a delay, so I keep interrupting you. Sorry. Over to you.
It's okay. I'm thinking that if it's called lucky, it means it's the one which is being talked about. So maybe in the near future, it will no longer be a neglected tropical disease. I think that's how I picked it.
Absolutely. I just like to, no, it's a neglected NTD. But you're absolutely right. I don't even dare to pronounce a lot of the other diseases. So, sorry.
Oh, sorry. No, carry on.
No, I was just saying to actually get back to your actual question before I went off on a tangent. I think the previous speakers have hit home quite well in that regard as well, that education is massively important, and we do actually see the very positive synergistic effects of education on mass rabies vaccination. And also, and I've seen that popping up in the chat as well, the population management. I mean, that's a whole different ball game again as well, but there are synergistic effects here. And what we've seen, for instance, I always love that story, looking at Goa, for instance, in India. Dog catching is by no means, I think, in any society a sort of glamorous activity, and in particular in India, it's not a particularly well regarded profession as well. And what we've seen shift over time in the project area is, as the people became more aware, the communities became more aware of the benefits that happened, of the project activities, you know, these guys, they were cheered on from the side of the road. It was amazing to see.
Wow.
Then all of a sudden the catching trucks went through the communities and people cheered them on at the side of the road, because they're helping to protect the communities, and people understand what it means, that intervention. So I thought that's always a great story. And you can really see that shift. And it's similar with dog population management as well, increasing awareness of responsible dog ownership, or in responsible animal husbandry as a whole, together with improved veterinary systems, so that people can access services as well. As one thing, telling people about what they should do. If they can't access it, if they can't get involved, if they can't help, it's a bit of a pointless exercise, as highlighted by Yona earlier as well. So we need to give them access, and that's where dog population management can aid rabies elimination or rabies control as well. Does it really have an impact with regards to reducing population numbers, less dogs to vaccinate, yada, yada, yada? It's very difficult. And if we're living in a limited resource environment, which unfortunately we are, investing in DPM, dog population management, it's such a high investment that then potentially takes away from speedy rabies vaccination. I always have issues looking at it from that perspective. Does it have, I'm repeating myself, does it have synergistic effects on rabies control with regards to community buy-in and community engagement? Arguably, yes. It's anecdotal evidence. I don't have research papers as such, but anecdotally, yes. But if we're talking a limited amount of money and we're talking about public health, invested in rabies vaccines.
Yeah, that's really interesting. There's actually a paper that's come out recently from the Swiss TPH looking at my background's in development economics. So when I saw game theory applied to this, it did catch my eye. Very interesting to see countries and regions broken down by whether investing in dog vaccinations makes sense, full stop, regardless of what neighboring countries or partners are doing. Should we focus on post-exposure prophylaxis, dog population management? All those are very interesting. And at the end of the day, as you said in your slides, Frederic, the proportion of that huge financial cost, very little of it is taken up by vaccination campaigns. So there is definitely a lot of room there for, when we're talking about resources, to explore lots of different approaches and complementary ones. So thank you, because you've really said something very interesting there, but also gone quite a way of answering Professor Hermandi's question here, who was asking if there's any strong correlation between effective dog population management programs and successful rabies control. Do you think a rabies control program can be successful in the absence of an effective dog population management? That's the big question.
I think, well, I think so, yes. Again, it's a lot of it comes down, unfortunately, to resources. So everything we discussed today, someone has to pay for it, quite frankly, whether that is community engagement, whether that is the actual vaccination, rabies surveillance, etc. So by directing our resources in the most efficient way, we will be able to get on top of the disease. I didn't want to sound all doom and gloom earlier, so that was not my intention. But that is a big challenge, and sometimes dog population management can again take away the focus from that very targeted investment that has a benefit on both animal and human health. DPM has a place. Again, there are synergistic effects. Absolutely, but we would have to cost benefit that out and see if, from a rabies perspective, again, if we're talking about nuisance, noise pollution, human health in the sense of dog bite exposures, etc., completely different story. But just from a sheer narrow rabies perspective, DPM can take away the focus, unfortunately, a little bit.
Got it. Oh, that's really interesting to hear. Perhaps turning back to Given, there's another question or a topic that's come up a few times in the questions from the audience, and particularly Maganga Sambo saying here, I would also recommend responsible dog ownership, which is something that we touched on a few seconds ago. And so that is really part of what you saw in field in your research, the gaps there, but also some of the efforts really being made in terms of communities and each dog owner thinking about their relationship with their neighbors. And so are there any ways that you think we could accelerate responsible dog ownership in the areas that you visited, that you're familiar with?
Okay, all right. As I shared earlier, I say that, of course, there is a challenge with responsible dog ownership, because I think most of the people do not have, I could say they're not affectionate to their dogs. It's just the dog is there for the work, you know?
Right.
So particularly this one person shared that they had a farm somewhere, they rented a farm. And one thing he says, if his contract ends with that farm, he'll obviously kill the dog, because he goes with the dog to the area just to provide security. But after the whole contract with the farm is over, they'll no longer need the dog, so they'll kill it. So it was something I was like, oh, these people really kill dogs. You know, it was something that, you know. So I think one thing, as I also shared one of the initiatives that those people use to bring responsible dog ownership. They charge the dog owner for the costs of taking care of the other person if it happens their dog bites the other person. So I found that really interesting, because in these communities where dogs are left hanging or stray because they can't provide food for the dog, and most people's concern is that I would rather buy my own meal, because they're not sure of their own meal. Why should I buy for a dog their meal, you know? So it's something I think it was really nice for those people to bring control, like to charge dog owners for medical costs if their dog causes problems. But I think another thing they could do is to to constrain the dogs, or to not let them, you know, free, like to keep them in cages, something of the sort. Like they shouldn't leave their dogs to go wander around to seek food or something like that. Dogs should be caged. They should only be left out on the necessary hours, or if it's to provide security at night, it should be for that particular time. If it's to go with them to the farm, it should be just for that need. Otherwise, they should be enclosed. Yeah, I think that could really help with responsible pet ownership. Yes. But again, availability of vaccines, because some of the places there were no vaccines. So most people would be like, why should I keep a dog? Because sometimes it could even pass 3 years. We haven't received any vaccines. So there is a need to make sure that there is constant provision of vaccination. If it's the yearly provision of vaccines, it should be that. Yes.
Fantastic. And I am keeping an eye on the time, because time's running very fast. There's never enough time to discuss all these things, but I did have one final rounding up question to conclude our discussions today. Just before that, I think there was just a kind of a technical question here from Semu Adenis, who was asking, how do you monitor the numbers of roaming dogs vaccinated, and particularly preventing double vaccination of roaming dogs? That was quite, yes, I'm wondering as well. I don't know who would like to answer the question.
I can probably jump in there, because it's probably in relation to some of my slides. But basically, very easy paint, livestock marker. So basically, what we're doing is we try to achieve that vaccination coverage in a very short amount of time in order to break that disease cycle. So we're covering this area really, we're blasting it. So what we need to do is just at the time we're going through, know, as you said, which dog has been vaccinated in order to prevent double vaccination, a double effort of catching, really. The double vaccination wouldn't harm the animal as such, but it would be a waste chasing after an animal for 10 minutes twice. So that's really what we want to avoid. So we use livestock markers, for instance. They're readily available. They're very cheap. You can mark hundreds of animals with one marker. doesn't really add a lot of cost to your campaign, and your teams know which dogs have already been vaccinated. And this pain usually stays on for a few days as well, which then in turn also in areas where we do conduct post-vaccination evaluation as well of our efforts, that post-vaccination surveyors would be able to identify these individuals in a resite survey or in a side resite survey as well, to see, okay, what is our estimated vaccination coverage in this area.
Fantastic.
In some places, we also use collars, differently colored collars by year, but there are some pitfalls with that as well. Cost being one, you want to make sure the teams don't put it on puppies, because that can cause horrendous injuries. So animal welfare has to be considered in those cases as well. Microchipping, unfortunately, is a little bit too expensive at that scale, but would of course be part of the responsible dog ownership later on as well, to truly identify your animals in areas where we can take that next step.
That's been really useful, and explains why when you're looking for images related to rabies, a lot of dogs have a little bit of red on them. Now I know. Thank you. And so finally, to wrap up kind of our conversations, a final question for all three of you. Rabies, of course, a zoonotic disease, the One Health lens, and just picking up on some of the things we've been saying in this discussion, is some of the neglect of rabies perhaps down to the fact that for many stakeholders and in many partnerships, it feels like this might be something that falls to the veterinary sector? And so this audience is very much one concerned with human health on average. And so how is this a distorted perception that perhaps the veterinary sector could do more, could provide more resources? How can we boost this collaboration? What can we do as a sector? And also opening this up a little bit to some of the questions asked by Ivana Balter and Semyu Adeniyi again, thinking about wildlife reservoirs of dog rabies. So can the veterinary sector do more? Is it already doing so much and we just aren't in tune with that because we are more of a human health audience and network? Or what could we do to boost collaboration? And I'll ask the question back to the running order, I'm afraid, Frederic.
Fine, I'm itching to answer that one. So as the vets on the panel, yes and no, to be quite honest. So let's not kid ourselves. The veterinary or the veterinary sector falling under the Ministry of Agriculture in most places is unfortunately terribly underfunded, in particular in comparison to the resources that ministries of health have available to them. So it's not necessarily even a question of do the vets want to do more? They want to, they often can't. So unfortunately there is this resource gap. At the same time, if we're looking at the success story that South America, Latin America has been over the last 40, 50 years when it comes to rabies elimination, all of these efforts were public health guided. So it was actually the human health sector that took the leadership in close collaboration with the veterinary sector in that regard. So I don't necessarily would say should the veterinary sector do more. They would love to, but I think actually in a lot of the areas, in a lot of the regions that we're talking about that are worst affected by rabies, I think the human health, the public health sector actually needs to step up a little bit more and help their veterinary colleagues in order to achieve that. We can only do it together. Again, the Americas have shown that, but it does actually need a little bit of public health leadership here overall, and not just lifting your hands, this is an animal issue. And I think that's where the crux lies a little bit. And yeah, great to see you, Maganga, as well. Great to see you. You're commenting on here as well.
Well, thank you. That was really insightful. And given you actually an intern with the Ministry of Health in a very pluridisciplinary team with health environmentalists, medical doctors, wildlife experts, and even economists. So do you feel how can we improve this collaboration? Do you feel the veterinary sector is doing enough?
All right. First of all, I'd like to acknowledge Mr. Maganka. Mr. Maganka was my mentor in my 2021. 2021, what is this field work for Afrohon Kisarawe? So I'm like so delighted to see him. At first I was like, oh, it's him. Yeah, it is him. Okay, it's just that I was from Muhimbili and he was from another university, SUA. So, so from my perspective, I would say that I think the veterinary field, the vets will correct me, and Mr. Maganka is here, but I feel like the veterinary field is way stronger to deal with these diseases which are interconnected with the One Health field when we are as one health, because we even in the when we were going through the research or the field work, we went to this association which is more related to vets, and they were like, most of the funds that they depend on, it's from the international organizations that fund them to produce, to deliver vaccines and to deal with the rabies cases in the Serengeti or wherever place. So I feel like when One Health comes in, that's where we strengthen this network, because each discipline doesn't stand on its own. We stand as a team, like we need this. We need to deal with the disease because humans are being affected, the animal welfare is being affected, the environmental aspect is being affected. So I feel like the One Health approach gives strength to the veterinary field. That's my perspective.
Fantastic. And Yona, for the final words, as the One Health Society, how can we bring in more veterinarians? How can we strengthen that collaboration? What are your plans?
Okay.
Oh, I wonder if you're not back. No, if you're not back on mute. No, you're not. Sorry. Carry on. My mistake. Oh, I personally can't hear you. I don't know about my fellow panelists. I'll just give it a second.
All right.
You could always try and refresh your page, Yona, while I say a few words of conclusion, and then I'll hand.
I'm seeing something from Mr. Maganga.
Yep.
He says, if veterinary care is available in rural areas, could dog owners pay for it?
The age-old question, isn't it?
I know.
That's the age-old question.
I was like, you guys aren't adding anything to this. All right. So, okay, I think one of the challenging thing that I saw in the field is that most people cannot afford, because I think this is something that we have overlooked. Most people cannot afford the vaccine, and people cannot afford for the vaccine for the post-exposure. Most people cannot afford. And so I think what he's saying, like, could dog owners pay for it?
Yeah, thank you so much, Marianne, for the nice question. I think the coming of the One Health approach itself with the collaborations, simply because it's a combination of. I'm not on mute. Thank you. I think that one of the collaboration we have is the One Health approach. Environmental. Hello, I think do you hear me?
Now we've got you.
Hello?
Yeah, we hear you.
Oh, we just lost Yona again. Sorry, Given, you were interrupted at that point, but I think he's just going to join the room again. We'll give Yona a chance, hopefully, with the internet being on our side. Over to you, Yona, for your final words.
Thank you. Thank you so much. Yeah, okay. Thank you so much, Marina, for the nice question about veterinary to be included in collaboration. I think myself that this One Health approach is already a collaboration. What's supposed to be done there is implementation. You know, speaking about itself One Health approach without implementing the initiatives is not impossible for us to eradicate rabies. So I think that before we're speaking about the resource, limited resource to support the rabies eradication, this is not for rabies itself. We know that NTDs, the majority of NTDs, we are in burden of lacking of a fund from donors. So I hope we're supposed to make the strategic plans on how can we get ISRO-first data. You know, you cannot plan if we don't have a data. Even in Africa, like we don't have exactly the data for the rabies. And if you find country statistics, one from another, it's hard to get the exact global the burden of the country in rabies. So I hope that if we could make the research to have exact data on the burden of the rabies, it's easier even for the political leaders to engage in, you know, to have some amendments to the policy changes. If we change the policy, exactly we will be directly going to have the implemented collaboration between the veterinary and other human health on eradication of rabies. So I hope One Health approach needs implementation. Itself is only collaboration simply because it allows people from environmental, human, and variety to come together to have the same strategies on fighting rabies.
Yona, thank you so much. That is a really great way to end this session. Funding will come when the case is clear, and the case will be strengthened with improved data. That's also given everyone on this call homework to do until the next World Rabies Day, really to work to build that case, get a clearer vision, more data, improve collaborations and awareness, all this driven by this incredible energy that's among the youth. Every time we answer a question on this panel, it opens up another discussion. I think that's what happens when there's very passionate people in the room, both as speakers and in the audience. But unfortunately, we have run out of time for today. And so all that's left for me to do while we really think about all this amazing thought that you've shared with us, explained so clearly. Thank you, Frederic. Thank you, Given. Thank you, Yona. Well, the last thing I will be left to do is to wish you well until our next World Rabies Day. A huge thank you to our audience as well. Always lovely to, in brackets, meet up with you and see very familiar names and faces. I think we missed Dr. Maganga Sambo on the panel though, so next year, it will be over to you. And I look forward to all the many friends that are here on the call today as well. If you want to present in a future ISNTD Connect, please always welcome to. Lovely to see everyone. But on that note, I say goodbye until next time. And again, all the very best from us here in London, and a big thank you to our panelists. So thank you so much and take care.
Thank you so much.
Yeah.
Thanks for having us. Thank you.
Thank you so much. Goodbye, everyone.
Goodbye.